I'm pleased to be joined on HealthBeat by Dr. Robert Prince, board-certified pain management specialist with Faith Regional Physician Services Pain Management in Norfolk. And Dr. Prince, if you would, tell us about the most common conditions that you see as a pain management specialist and how you treat them.
Thanks, Rob. The most common kinds of ailments that we see in the pain clinic are going to be low back pain and neck pain. There are a lot of rarer things that people certainly come in with, but that's sort of the meat and potatoes of what we see. And typically what will happen is patients will try physical therapy, they'll try chiropractic, they'll try tincture of thyme, they'll try anti-inflammatories. And when those things don't seem to be working, typically they'll be referred or self-refer to us. Most people think of if they have hip pain or knee pain, they're used to the idea that it might be arthritis in their joint. Interestingly though, most of, or quite a bit of low back pain can also be arthritis in the joints in the spine. So if you could close in a little bit here, and I'll use a pen to point, you can see that each vertebrae, like dominoes, sits on top of one another, and there's a little joint formed between them that allows us to extend our back and flex our back. And those are the joints that can get arthritis. And typically people will complain of difficulty sleeping on their stomach, difficulty getting up from a seated position, that sort of thing. And we have the capability under X-ray guidance of placing steroid in those joints, which is a powerful anti-inflammatory. Or if that doesn't work, we have the technology to put a small needle in, heat the tip up, and burn the tiny little nerves that go to those joints. And it renders them numb for about 1.5 years at a time, and then we would have to repeat it. Unfortunately, we don't have the technology to replace those joints like we would in a hip or a knee, so this is the next best thing.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.